Once people reach their goal weight on the semaglutide, they inquire if they should taper off this medication or still stay on. So there's a couple ways of doing it. For some people, they can just taper off that medication. How you taper off is you simply just stop doing the injection. Keep in mind the half-life of that semaglutide is around 7 days, so for you to feel that it's not in your system might take about a week or two for it to be out of your system for the most part. When this happens, you might notice your cravings are slowly coming back and you feel like you're thinking about food a little bit more often. But don't be alarmed. You made lifestyle changes to get to this new weight that you're at. So continue the lifestyle changes and to maintain your new weight. The best thing you can do to maintain your weight is to try to build muscle mass. Ideally, when you're losing the fat, you should be gaining a little bit of muscle. So if you gain 4 or 5 pounds of muscle mass, now your basal metabolic rate should be a little bit higher. What that means is you need a little bit extra calories a day to maintain your new weight. Muscle mass dictates how big of a caloric need you need for the day. So the more muscle you can gain, the better chances that you will maintain your new weight. Now, if you notice that your weight is slowly getting back onto you, half a pound a week here, half a pound a week there, you notice a month or two in, you're up a pound or two, then you need to make some changes. So some people take a small dose of semaglutide to maintain their new weight. You don't necessarily need to take the full dose or 2.4 milligrams of semaglutide or 1 milligram of semaglutide. You can take half a milligram or even a quarter milligram of that semaglutide. When you microdose or take a small dose, your goal is not necessarily to lose weight, it's more of to maintain the cravings and to maintain your new weight. If you want to stay on a small dose of semaglutide, we offer a pay per vial kind of program. So one vial can last you 10 weeks. It could even last you 20 weeks of that medication in one vial. It's not a monthly billing. You just reach out to us whenever you need more of that medication. So put it in perspective, if you're on a half a milligram of that medication, that vial should last you 20 weeks, and that's 4 months. If you're on a lower dose, it might even last you even a little bit longer. But our goal is to help you maintain that weight with just a small dose of that semaglutide. If you have any questions, reach out to us at 585-524-0300 or our email is rochestertrt@gmail.com.